Pharmacy Friends brings industry experts to the same table to talk about what's happening in pharmacy today, what's coming, and most importantly, what it means to you. We explore and share pharmacy trends stemming from the evolving healthcare market, where advancements, policy changes, and technical advancements make a difference. So I've had the pleasure of attending the 2023 AMCP Annual meeting, AMCP Nexus, and now AMCP Annual 2024. And the energy from attendees and the topics covered at the conference seems to keep getting bigger and bigger with each passing event. We're fortunate to have Susan Cantrell, AMCP CEO, join us for a conversation on what this conference means and how it continues to have an impact on the healthcare industry. We also have Pat Gleason, AVP of Health Outcomes, offer his insights on the conference as well. So how many interviews have you had today so far?
This is the first.
This is the first one?
Yeah.
Okay, well that's a good thing.
Yeah.
Good
easy day.
All right. Well, we'll keep it that way. So, Susan, we really appreciate your time, and thank you for coming by. I know it's a very busy schedule, but how has the AMCP, I almost said it. I'm going to stop. I'm going to repeat that. I was told to not say show. And now I'm thinking about it all the time.
Thank you for that. Did you tell him that? Thank you, Pat.
See?
Yes.
Pat's
it's a conference, not
exactly.
a show.
It's a conference, exactly. So, Susan, thank you for your time. We really appreciate it, and thank you for all of your time prepping for this. But I just want to say that it's a pleasure to have you, and I know you have a lot of commitments during the conference. So thank you for your time. So tell us a little bit about the conference. How's it going for you?
Well, first off, thanks for having me. It's a pleasure to be here, and it's going quite well, I would say. We are back to pre-pandemic levels for our attendance, so we've got 3,500 of our closest managed care pharmacy professional friends here in the city of New Orleans. I think there's a really positive vibe, lots of energy, in spite of all the challenges that we're collectively facing. Everyone seems happy to be together and to be in this great city. So far, so good.
That's terrific. So tell us a little bit about how AMCP has worked to be at the forefront of pharmacy trends to improve access and reduce costs. So particularly as healthcare trends show that the pharmacy benefit is becoming more expensive.
That's what we're all about at AMCP, obviously, improving health by ensuring patients have access to high quality but affordable medicines is really critical. And we all know that the cost of healthcare in the U.S. is rising astronomically. Just recently, a study came out from Reuters that shows the median price of new novel therapeutics approved by the FDA in 2021 was $180,000. That jumped to $222,000 in 2022, and in 2023 it was $300,000. Astronomical leaps in the cost of therapies. However, we're in this remarkable period of innovation, so our challenge becomes how do we pay for all of this? And part of what we do at AMCP as we look at the pharmacy trend and the challenges associated with affordability of prescription drugs is advocate for policy changes that might be helpful. And one that's top of mind for us right now is called the Medicaid Value-Based Pricing Act, or MVP Act, introduced in this session of Congress by Congressman Guthrie. What that would do is kind of clear the way for value-based purchasing in the Medicaid program, helping some of our most vulnerable patients. And so that's one area that we're looking at. And I guess another example in terms of if we think about the cost of healthcare and prescription drugs, what's really important is that we use those therapies correctly. And how better to do that than with the aid of our well-trained, very skilled pharmacists. So there's a bill in Congress right now called the Equitable Community Access to Pharmacy Services, or ECAPS bill, and we're working with our partners across the pharmacy spectrum to encourage Congress to pass that bill, which would open up the door for pharmacists to test, treat, and vaccinate against various communicable diseases on a large scale, and also get compensated for those services. So a lot happening in that area, but that's right in our areas of focus.
That's excellent. So let's talk a little bit about diversity and health equity. So they're also key AMCP values. So how does the organization work with pharmacists, physicians, nurses, and biopharmaceutical company professionals to ensure managed care pharmacy improves these health disparities?
We're pleased that so many organizations and disciplines like AMCP have really latched on to the importance of enhancing health equity and addressing gaps and disparities that exist in terms of healthcare access as well as use of medicines. And it's been a strategic priority for us since 2021, where our board saw in the wake of the pandemic the disparities that were really laid bare in that public health emergency, and said, we have a role to play in this as AMCP. We need to do something about it. And they really stepped up to the plate to make addressing disparities in medication use and access a strategic priority for the organization. And we continue our work in this area. We've recognized that AMCP as an organization can't itself ameliorate all the problems that exist out there, but what we can do is take a leading role by elevating the issue in our members' minds and sharing information and best practices about what can be done. So for example, at each of our meetings going back to 2021, we've had sessions that focus on health plan efforts and PBM efforts to really address healthcare disparities and improve access. We continue to do that. We have a resource site on our web center. And I mentioned a moment ago the MVP Act. You know, that's a perfect example of where we're looking at the Medicaid population and how do we ensure that those patients have access to these cutting-edge therapies that are coming to market with very high price tags. This is part of that effort. And I would say one other thing that we think is really important is to shine a light on the great work that our members are doing in this area and addressing health equity challenges. And so we have a campaign going on right now to really elevate the visibility of managed care pharmacy. We're calling it We Are MCPs. And we hope that through that we'll continue to shine a light on the good work that's being done and encourage others to share programs and really take up the stake to address health equity head on. And if I could, I want to also mention our journal as a source of great information on this topic. In 2022, we issued a call for papers on healthcare disparities. Since then, we've published about 30. I'm happy to say I have one that just yesterday got accepted for publication, so we'll see it soon. But we're really focusing on that in all channels of AMCP communication.
That's wonderful. And obviously, yeah, go ahead, Pat.
Yeah, Susan, I'm really proud of what AMCP does, and as Prime Magellan RX, our work to ensure that we're delivering care as we would to our loved ones. And given the opportunity, and thank AMCP for that, we have a session here on presentation on using social determinants of health information to better identify medication non-adherence, and share that and learn from others as well. I mean, it was a great session yesterday on social determinants of health and the impact that having that information can have, try to improve adherence from MTM outcomes as an organization. So I just want to say that thank you for that, and we continue to work together to learn and help those that have those health disparities and address them.
Pat, your work at Prime Magellan is exactly the kind of thing that we want to showcase here at AMCP. So I'm glad you brought that up. And the lack of information and data was identified early on by our Health Disparities Advisory Group as one of the biggest challenges to overcoming these issues. We don't have the data, and so managed care pharmacy professionals, I think, play an important role in collecting and documenting that using Z codes or other methods. And so I was delighted to see that on the agenda, and thank you for bringing that forward.
So how do attendees gain perspectives on these current trends, emerging challenges, and other strategic insights that they need to navigate this ever-evolving landscape?
Well, I'll use the example of where we are today as a great one for how they gain insights. Coming together in a forum like the AMCP Annual Meeting or AMCP Nexus this fall is really the best way that I can think of to share and obtain new knowledge and information. We have so many panel discussions here. We had a session this morning on innovative contracting methodologies with a speaker from the UK who has a global perspective on it. So there's some really, really outstanding sessions taking place here. We, at this meeting, also just released the 5.0 version of our AMCP format for formulary submissions, which has become, over the last 24 years, the gold standard for how payers want to receive information from manufacturers. So there's so much happening here, and I think coming together in a forum like this is the best way that we can all share knowledge and information. And it doesn't have to just be from the speakers either. I see so many hallway conversations and, the water cooler conversations, or like it or not, we're in New Orleans, the conversations over the Sazerac in the bar, there is so much energy and networking and information sharing that takes place in a forum like this.
Susan, can you comment on the Research Institute? I'm super excited to see that.
Yes, we are too, Pat. Thank you for that. So AMCP has been in the research space since 2015, when we made the decision to launch what's called the Biologics and Biosimilars Collective Intelligence Consortium, or BBCIC. And that group has done some amazing things over the last 8 years in terms of generating evidence using pharmaceutical claims data as well as other sources, but real-world evidence to support decision-making with biologics and biosimilars. And what our board decided is we really need to build on that. We have an infrastructure existing now for conducting research that also aligns to our AMCP Foundation research agenda. So how do we better leverage that for the good of the managed care pharmacy community, but also, more importantly, for the good of patients? So we announced yesterday the launch of the AMCP Research Institute that will do just that, build on the work that we've done on BBCIC. BBCIC will remain as it is and continue to do its good work, but we'll use what we've learned and developed from that to really broaden our research footprint in managed care pharmacy, and very excited about that.
And the collaboration between the payer organizations and the pharmaceutical manufacturers. That's what AMCP brings those groups together to then move forward on real-world evidence generation to help people get the medications they need and live well at an affordable price. That's the holy grail, and we're working toward that together through AMCP.
Exactly. You're going to be hearing a lot from us, too, on the topic of real-world evidence in 2024. It's one of our priorities in our thought leadership portfolio. So we have a lot of work that we're doing in that area. It's evolved so much over the years, so what does really good real-world evidence that payers can use look like? And how do we make sure that we are conducting studies that are aligned with the best practices? And how do we disseminate that information? And then on the payer side, how do we use that information in the best way? So you'll hear a lot from us on RWE.
That affordability problem you started out with at $300,000 a year, how are we ensuring that that's good investment?
Exactly.
Yeah.
Mm-hmm. So talking about real-world data, that was obviously a key feature of our GLP-1 research, which we're talking about at the show. But I was just going to say, or at the conference rather, but what are some of the other trends that you're tracking at the conference this year?
It's hard to keep up, certainly, with everything happening in our world because it is such a rapidly changing space. I would say one thing that will continue, I think, to gain steam that has been on our radar screen for a number of years, and certainly top of mind for all of our members, is evolving treatments for rare diseases. Those come typically with very high price tags, and so affordability is a significant challenge. That's not likely to go away. We know there are 7,000 plus rare diseases that have been identified, and our speaker this morning shared that when you look globally, 1 in 17 people suffers from a rare disease. And if you think about the impact of that on a patient population when a new therapy comes out that's in the 7 figures, it's significant. So how do we afford this innovation? That's not going away anytime soon. But you mentioned GLP-1s, and I think that is an issue that hasn't completely caught us by surprise, but it's kind of added a curveball that maybe we hadn't thought so much about, because you've got a therapy that, yes, it is expensive, but by today's standards, not a high investment therapy per se, but you've got a very large potential patient population. The same could be said for a disease like alcoholic steatohepatitis, so NASH and MASH. Those are evolving diseases with very large populations, and so affordability takes on a different lens when you look at that. So I think those will continue to be major issues for us. And then I would say we're in a challenging political year. We're in an election year, and healthcare policies are top of mind for the politicians and also for the voters. And so that creates this element of uncertainty, and none of us probably enjoys uncertainty. And in healthcare, we need stability and certainty. And so an election year causes us to take a step back and say, what will this mean long term, depending on how the election goes, to health policy and health legislation in the coming year. So there's a lot to think about in the world of managed care pharmacy right now.
There certainly is. So we're going to have a little departure with our next question. We've been asking all of our guests some questions about our host city, and we're going to have an opportunity for you to join the fun. So, a question about New Orleans. Dr. John had a spanning career in music and is widely recognized for his talent as a piano player. But that was not his first instrument. After suffering a gunshot wound in the 1960s that injured his ring finger, he found it difficult to play this instrument and made a change. What was that instrument?
Oh my goodness. Guitar?
It is, correct.
Well done.
And I'm wondering if that was the reason, that experience was the reason that he wrote the song. I was in the right place, but it must have been the wrong time.
You know what? You might be right about that. This has been a terrific conversation, Susan, and thank you so much for your time.
Thank you for having me.
Absolutely.